Hello, my name is Ari Macias. I'm a student physical therapist, and today I'm going to be sharing some information about therapeutic intervention of endogenous opioid release through exercise. So this is just an effort for pain management. So before I get into the specifics, really about what that is saying, I first just want to talk about the significance of exploring other options of pain management for patients. And that is primarily due to the current state of opioid prescriptions in the United States. So according to the CDC in 2020, per 100 people, 43.3 of them have had an opioid prescription. And even more so, and 3.6% of US counties, there were actually enough prescriptions administered, excuse me, for every person to have one. So why does this matter? Um, why does this high volume of opioid prescription matter? So there's a couple of reasons. And first of all, there are severe potential side effects with the misuse of opioids. They are decreasing that neuronal excitability, which can cause hypoxia. And then as a result, you could have a coma, permanent brain damage, or even death. Additionally, while the prescribed opioids might be great in suppressing that pain, which could be helpful with therapy, um, it in itself is not directly addressing the problem of the potential reason of pain for a patient. So it in itself um, is not going to help increase the patient's well-being over time. It's just going to help suppress that pain. So with the use of prescribing exercise and the attempt to have the endogenous opioids released, you not only could help with pain management of the patient, but additionally, you could help just increase their fitness and well-being over time. So, kind of what I just said, that is the relationship potentially to physical therapy for us. So, it could be through just specific exercise prescriptions in order to get the analgesic effects from endogenous opioids that are released during so. So right below that, I have a study. It is the opioid supplement hypothesis study. And basically what they were testing for is basically everything of what I just said. So they had patients and had them go through an aerobic, excuse me, patients who were experiencing low back pain and had them go through an aerobic exercise training program and throughout had them, excuse me, perceive uh, their pain levels throughout, and then compared that to the same patients perceiving their pain after taking dosages of approximately 7 milligrams of morphine. And what they found was that they experienced very similar and actually in some cases even lower pain perception from the aerobic exercise training program. So this could suggest either a reduction or even an elimination uh, of opioid usage with the addition of aerobic exercise, obviously depending on the patient's level of pain. So some clinical applications. There's two that I have here. This first one is just an exercise parameter used in a study. Uh, they had both men and women in an 8-week trial of an aerobic exercise training program. And so what it was is they had them do a 5-minute warm up, 30 minutes of exercise, and a 5-minute cool down. The mode of exercise varied, which is great. It allows the patient to it allows the patient to decide what kind of exercise they may choose. So, they could have been running or cycling, swimming, etc., just aerobic exercise. It was performed 3 times a week, and the desired effort was 70 to 85% heart rate reserve. It's about a RPE of 14 to 16 on Borg's 6 to 20 RPE scale. And their heart rate zone was established using the Karvonen formula. So that is the specific thing primarily with these parameters. There is a certain level of intensity that is required in order for the patients to have those endogenous opioids to be released and to start feeling the perceptions of pain reduction through it. So they also, due to they were primarily working with not highly fit individuals, it was also a progression of the duration, excuse me, of the exercise. So they started initially with 15 minutes for a week or two, and then built up to 20, and then ultimately up to 30. Additionally, with that, they also, with the 15 and 20, had a lower percentage of heart rate reserve and a lower RPE. So they kind of treated it as progression. So it wasn't an immediate 30 minutes at a hard level of exertion in order to get the effects. So again, while they're doing that lower intensity, you're not going to see the effects, but it's all just in the safety of the patient to properly progress and not see an increase in the pain that they already are experiencing. So, and again, from the study, both men and women indicated improvements in their pain over the 8-week trial, which is great. So then additionally, so one thing you might ask yourself with that is, well, what if I have a patient who cannot complete 30 minutes of exercise at that intensity of exercise? Well, so here there is an additional study that I found involving aerobic exercise and blood flow restrictions. So what they did was run a couple of different tests with patients with different levels of pressure and blood flow restriction. And what they found was combining blood flow restriction with low intensity exercise at about 80% limb occlusion actually resulted in hypoglycemia similar to high intensity aerobic exercise. So the low compared to high being a 40% VO2 max versus a 70% VO2 max. So that could potentially be another great option if you have a patient who cannot perform that level of intensity. You could do potentially a lower intensity aerobic exercise within the inclusion of blood flow restriction. It did mention at the end of it that there was more research needed, but again, it could be a potential option of creating hypoalgesia at an exercise intensity that typically doesn't have the hypoalgesia. So that being typically in the 40% VO2 max, the patient might not see the endogenous opioids released, but then with the inclusion of the blood flow restriction, they then do get to see it, just to make that clear. So those are my two clinical applications of a potential utilization of exercise for pain relief through endogenous opioids. And then here are my references, and that is it. So thank you very much for your time.